All right, welcome to everyone. Just very excited to have Suzanne Gordon with us, discussing this really critical topic of the the issues that wrap around the lives of veterans and in the United States, and also how we what are best practices in terms of engaging with veterans, having the conversation about healthcare and health issues. And that's really the setup for today's conversation. And we really want this to be an intentional focus on the lives of veterans, who, by the way, between veterans and their immediate family members, constitute about 15% of the U.S. population. And also Suzanne, who I learned a lot from Suzanne when she came in and spoke with us several months ago, that it's the Department of Veterans Affairs. It only serves about 40%. Is that right, Suzanne? About 40% of the veterans population, and you'll explain to us why that is.
Yeah, I'll explain it.
But in short, I'm here in Washington, D.C. I've relocated to Washington for purposes of promoting and advancing this very specific legislation to help states innovate healthcare reform. And that's what's called the State-Based Universal Healthcare Act that was recently introduced by Representative Ro Khanna on November 8th. State-Based Universal Healthcare Act. It's HR 6270. If somebody gets a chance to just drop a link every once in a while for HR 6270 into the chat, that would be very helpful. Because it's through state innovation, I think, that we can address a lot of these issues related not only to veterans, but the next project that we're going to be doing in March, just to give you a quick heads up, that we're going to be doing another conference around disability issues, disability rights, disability justice. And there's an intersection of all these issues. People often say, how do we engage with labor? How do we bring other folks into these discussions? Well, what we do is we find people who are in organized labor who are also veterans, and vice versa, and people who are active on housing issues that are veterans and labor. So I think a lot of us fret quite a bit about, we've got to get labor in order to pass this legislation. But I think the best way to go about it, frankly, is to recognize that we all wear multiple hats, that we belong to multiple constituencies. And then when we stitch all of these together, thinking of our issues in terms of the intersection of issues, then we actually have a strategy to win. That's what brings us all together, but not to treat ourselves in isolation from others, but actually to see ourselves as being involved on any number of issues. And so I'm going to just touch briefly before bringing up Suzanne on the mission of the work that we do at One Pair States, as well as the work that we do at Justice for All Network, which intersects again with what Suzanne's going to be talking about today. But let me just go over just very quickly, with Suzanne. I'll introduce Suzanne very briefly. Suzanne will make some comments, 15, 20 minutes. We'll open it up for conversation. I've got, I don't know, Suzanne, I don't know if you've ever met or Victor Madeja from the Lehigh Valley in Pennsylvania. He knows you. He's active in numerous veterans communities. I've asked Victor to come in and provide some of his reflections as well. And then let's just open it up for conversation for the period of time that you're able to stay with us, I think, until probably about 12:45 Eastern, 9:45 Pacific. Is that correct, Suzanne?
I can probably stay till about 10.
Okay. We'll just roll with things. We're all flexible organizers here. We all learn how to tiptoe in and out of conversations and how to build power and alliance with one another. So again, just to repeat for anybody who's come into the room, use the chat function on your Zoom screen to introduce yourself. Tell us where you're from, who your member of Congress is. Indicate, if you would, your personal pronouns. This is a way as a way of intentionally welcoming younger people. I just went over the run of show. Let me just say that this event is co-sponsored by One Pair States and the Justice for All Network, as well as several other of our partners, including Social Security Works. One of the things that I hope that you will be addressing here, Suzanne, is this debt commission that the Republicans are rolling out right now, and how this represents an existential threat, not only to Social Security and Medicare, Medicaid, but also the VA. That's a really hot topic right now. This is what the Republicans are doing. They're going after these earned benefits programs. I hesitate to call them entitlements. These are earned benefit programs. So just to say that One Pair of States was loosely formed back in 2009 as an informal network of state-based organizations. 23 states now comprise the group of One Pair of States. And these are state groups that are working to set up universal healthcare systems at the state level. And One Pair of States is the consortium of those states, and we're working in support of states. And that's why we center our work primarily on the legislation that I mentioned, the State-Based Universal Healthcare Act recently introduced. That's House Bill 6270. And that bill would provide what are called super waivers to get the federal dollars back to the states with guardrails, making sure those dollars are exclusively focused on healthcare needs and the design of a universal healthcare legislation that's already passed each of the states, who then apply to the Health and Human Services Secretary. They set up a commission, they review the legislation before providing the waivers. So that's in simple form what the State-Based Universal Healthcare Act is about. One Pair of States, our work is in pursuit of what we call health and healthcare justice. We say health and healthcare justice. We can't simply set up a healthcare system and expect that to solve all of society's problems. We have to recognize that there are any number of health issues, housing, education, environment, policing, that wrap around our lives that determine what our health situation is going to be. We can't simply throw everything at the healthcare system to solve all our problems. So we work in unison. We work in alliance with organizations that are working on housing, that are working with veterans, that are working with young people on climate and so forth. That's how we need to think about our work. So that's One Pair of States. And then Justice for All Network is very similar. It's like Bob Mason, who's with us today, describes ourselves as a think tank with a heart. Justice for All Network is a place where we develop strategy and where we develop the ideas that bring us to people like Suzanne to have this conversation and learn more about what it is that veterans can do. And I guess the last thing I'll say before bringing up Suzanne is that my history with veterans goes back to when my dad was a veteran of the Korean War. My grandfather was a veteran of World War I and World War II. And when I was a college student, I was a military caseworker for Congressman Ron Dellums, who represents where you are right now, Suzanne. Ron was the chair of the House Armed Services Committee. And as a young intern, as a college student, my job was to aid and assist members of the military who were being, let's just say, subjected to unfair behavior. Because once you join the military, you sign away your constitutional rights. You live under the code of the military. So that was my job, and it was fascinating. But my empathy goes all the way out to our military service members as well as our veterans. So with that said, let me just say that again, Suzanne, who is just this amazing person who has come into our space recently and has been able to enlighten us and give us an understanding as to where we need to be. Suzanne is the author of several books on the topic. I've just read our veterans, and it addresses questions having to do with mental health, physical health, spiritual health, financial health, housing health. All of these issues Suzanne addresses in her writings. She's an amazing individual. And Suzanne, let's put your contact information, your website into the chat as well, so people will know how to follow up.
So I put in my email, and I put in our veterans book, and I put in Veterans Healthcare Policy Institute. I don't know, it doesn't seem to show up. Oh, it does show up as me. So you can find out about these issues at all those places, and you can also contact me at my personal email.
Oh, excellent. And a shout out to your husband, right, Steve Early, and your
Yes.
other co-author researcher, Jasper Craven.
Absolutely.
And again, exploring these questions having to do with physical, emotional, social, economic, psychological impact of the service on our veterans, and how it is that we really need to be empathetic, and how we need to understand these issues, and how the work that we're doing, which centers primarily on Medicare for all, single payer, how that needs to dovetail our thinking about what needs to be done with the VA. So with that, thank you again, Suzanne, and thank everyone for being here. if you can just populate the chat with your questions, and we'll do the best we can to pull them from there. And then we'll have an open Q&A once Suzanne is done, and then Victor comes up and makes a few comments. So again, Suzanne, thank you so much.
Could people put their video on? Because I want to start with a little quiz. And the quiz is, so I need to see your hands.
Take us off spotlight, Mike. Yeah.
Yeah, so if you could all, I mean, if you obviously are adamantly opposed, that's fine, but the more people that I can see would be so cool. Okay, so that'd be great. And people who work at the VA, you're not allowed to be part of this. So let me just begin by asking you a couple of little questions. How many, and please don't misunderstand the intent of this little quiz. It's not to show people up or anything like that. It's simply just to help us understand kind of where we are understanding veterans issues and the healthcare system that serves them. Okay, so how many people know that the Department of Veterans Affairs, which is the second largest federal agency, runs the largest healthcare system in the country, which is called the Veterans Health Administration? How many people know that it's the largest health system in the country? Great, okay. How many people, I'm gonna ask you how many people think that all veterans are eligible for care in the Veterans Health Administration? If you think it, raise your hand, because it's cool to, I mean, this is just a, great. How many of you know that the VA, on absolutely almost every measure that has been studied, outdoes the private sector in healthcare outcomes, from everything from mental health to cancer care to et cetera? How many people know? So it's the most successful healthcare system in the country. How many people know that the VA trains the majority of healthcare professionals in America? Okay, this is a very educated group. That's great. How many people know that after the National Institutes of Health, the VA is the biggest research powerhouse in America? So the VA is, I'll go over these things, and how many people know that the VA has as a fourth mission emergency preparedness, so that it is a backup to the civilian sector healthcare system in times of war, conflict, terrorist attack, and local, regional, and national emergencies? So you could go to the VA if you had COVID and your hospital was overwhelmed in New York City or New Jersey or Louisiana or something. You could get in even though you're not a veteran. Okay, so how many of you would make this argument if you were talking to Americans about the VA? Because I think that, it's not just veterans we have to read about the veterans healthcare system, and veterans who have to be for a national health system. It's also Americans who don't know anything about the VA, among them healthcare activists. How many of you, and I just totally lost my train of thought, but how many would argue that the VA doesn't just serve veterans, it serves us all? Because that's a really important argument. Okay, so this is a great audience, because usually I go into, I go to single payer groups, and like I went to Physicians for a National Health Program, and most of the people in the audience did not know almost any of what you guys are very up on, and so that's super.
Because we went to your talk a couple of months ago.
Oh, okay.
Well, we can remember.
Thank you so much. Thank you, Cheryl. You're so kind. So the point that I think needs to be made in this issue of intersectionality and so forth, and I'm going to get rid of me because I don't need to see me. The point that I think needs to be made is that veterans, although they represent a very small part of the American population, The current veteran population is 19 million. It's actually declining unless we have a new war, which I hope we don't, but God knows. And even though I don't believe in God, and veterans represent about 7% of the American population, and active duty service members, since we've done away with the draft, represent probably 1%. There's about 19 million veterans now, give or take. And if you, as you said, Chuck, if you multiply times their dependents, conservatively 2, but probably more, you get about 60 million people, and which isn't insignificant. And if you take a bigger chunk of that, then you have probably more people, maybe 80 million. Right now, the Veterans Health Administration, because of very misguided eligibility requirements, only enrolls 9 million veterans. 6 million are completely covered by the VA and use it exclusively. Probably about 11 million could be enrolled and fit the eligibility requirements, which are discharge status. And I'm not going to go into these unless you ask me questions. I'd be happy to talk to you about them. Discharge status determines whether you can get in, and so does whether you have a proven service-related disability and or a low income and or destitute. So the VA's patient population is the sickest, oldest, and poorest, and most complex in the nation. We're very lucky to have Rick Stagenberg here, who has been a psychiatrist at the VA. I believe he's retired now, but he knows a lot about this, and he can talk about the mental health needs of veterans. Veterans have, as a rule, they are much more complex. They have many more chronic pain issues, mental health issues, a risk for suicide, and they are at risk for all kinds of physical problems due to the recklessness, in my view, of the military as an employer. I mean, obviously, signing up for military service is a risk, but they are put at greater risk because of our elective wars, because of how we fight those wars, and because of the way that the military just doesn't pay attention to health and safety at all. And I really would, I mean, I know I wrote the book, but I really would recommend that you read Our Veterans if you are serious about engaging with veterans, because it's short. Well, it's not that short, but it's not like a doorstop book, and it explains the problems. So here's what I want to focus on. I want to focus on 2 things. And let me just ask you a question. Is there anybody on the talk who's a veteran? Like, great. Okay, Mike. So Mike, that's proving the point that I'm going to make now. Mike and Victor. Okay. I can't see. There's a lot of people that are that I can't see their faces. But well, Mike and Victor prove the point that a lot of people think that veterans are sort of uniformly kind of conservative, if not, completely hard right. And the media, in a way, I think, focuses on that message because it never shows a broader view of veterans. It never covers the left of the veteran spectrum. When you read commentary in the news, you almost always see a focus on sometimes, the traditional veteran service organizations, which are very conservative, like the VFW and the Legion, but you rarely ever see Common Defense, which is a wonderful veterans group. You very rarely see Veterans for Peace. I mean, yeah, I would almost say never. And so the spectrum is now, and now the spectrum is pushed to the right, where you get representatives actually in the New York Times viewed as legitimate, who are from the Koch brother funded Concerned Veterans for America. So we have this notion, I think often in progressive groups, that veterans are, why bother with the vets? Because they're just we can't engage them. They're not the kind of people that our message could appeal to. And I think that that's a tremendous mistake, because veterans, okay, maybe many of them are more conservative, but people's views are shifting. I didn't start out with the politics I have today, and people can change, and many people already are very progressive, and certainly on war issues, veterans can be very progressive because they've been there, at least the ones who've been in combat. So I think that we have to be aware, for example, there's 3 veterans now who are running for the Senate, who are very progressive, who I believe whose campaigns should be supported. One is Ruben Gallego, who is in Arizona and challenging Kyrsten Sinema, who really needs to be knocked out. And I would suggest people get in touch with his campaign and support his campaign. Another is Dan Osborne, who's running in Nebraska as an independent, and he's challenging 2-term Senator Deb Fischer. And then finally, there's Zach Shrewsbury, who's in West Virginia trying to knock out Joe Manchin, who we really should knock out. So here you have, there's folks out there who we can support, but there's also many veterans and veterans groups that we can connect with, because one of the issues around healthcare is veterans depend on the Veterans Health Administration, and there's a huge attack on the VHA, led by the same kind of people and sometimes the very same groups that are trying to privatize Medicare for all, they're basically trying to privatize everything, privatize and monetize and steal public money. It's not like they don't want public money. It's not like they don't want our taxes. They don't want to pay them, but they want us to pay them so they can steal them and then fund private profit. And so right now there's a huge attack on the Veterans Health Administration. They're trying to tarnish its reputation. They're outsourcing care to the private sector. And the attack on the VA has taken the form of legislation called the VA Mission Act of 2018. And this is outsourcing more and more care to the private sector. It's set up a parallel private sector network where money that should be going to providing the kind of care that Rick Stagenberg and many others provided, and that many others are providing, is going to private sector providers, and basically the quality of care they deliver is lower but higher cost than the VA. And it's very interesting because they set up in the Mission Act something called a Veterans Community Care Program, and it is now stealing almost 50% of the VHA clinical care budget. We actually don't even know how much it costs, because there's an appropriation in every budget for this Veterans Community Care Program. But then if the community care program exceeds the cost of the budget, it's allowed to steal money from the Veterans Health Administration's medical services account, and rather than going back to Congress for supplementary allocation. So the real costs of this parallel private sector network are concealed. And it is now pretty much clear and acknowledged inside VA and on Congress that this theft of public funds is so compromising the VA that it has become, as people in DC are saying, an existential threat to the VA, and the VA could collapse. So veterans could lose their healthcare system. And so it's up to us, I believe, to fight against VA privatization, and to join that fight and to lobby against VA privatization. But simultaneously, because of VA privatization, you can make the argument to veterans that they should support some form of universal health care, either at the state or the federal level. It's an interesting question. Yeah. Well, this is sort of an interesting question that we can talk about, and maybe some healthcare economists, I think Walter, or people may be there's some people on the call who could be very helpful here. It's a complicated issue because the VA is a federal system, and how that would work on a local level to take care of veterans is tricky. But let me give you the federal explanation. If we had a universal healthcare system that was tax funded, like, you know, Britain, like almost anywhere else in the world, they wouldn't be coming after veterans' money to pay for a private sector system, because there would be no private sector system. So, you know, if you had even Medicare for All, which is an insurance rather than a delivery system, you would take VA privatization off the table, because if veterans want to go to the private sector, they just go to the private sector. They're not stealing money from a public system to go into another public system. And so the incentive to cannibalize the VA to support a private system would be taken off the table. And so if you can appeal to veterans that to support a universal healthcare system, or some form of universal healthcare system, or building towards a universal healthcare system, because this would protect their system for those who already use it. Plus, the veterans who are ineligible for the VA for all kinds of bad reasons would be able to get care in our broader universal healthcare system, and so would their families and their children, because veterans do not, aside from the officer class, veterans do not come from wealthy backgrounds. If they lose their jobs, if they're lucky enough to have job-based healthcare coverage, if they lose their jobs, they're out of luck. They may be out of luck even if they have jobs, as so many Americans are. Their families and communities would benefit from universal healthcare. So there's a very strong argument to be made to engage veterans in the struggle for universal healthcare. I would argue that as long as we have an enormous veteran population which has very specific healthcare needs, we need a VA system as a population-based system within any universal healthcare universe, if we magically got it. You know, so if tomorrow you waved a magic wand and we had universal healthcare, we had an NHS or national health system like the British or whatever, you would still need veterans hospitals within that, because because we have such a huge military, because of our imperial needs and imperatives, and you have all kinds of people that have very specific healthcare needs that cannot be dealt with outside the VA. I've talked to many people and physicians for national healthcare and so forth, and many people, there's a lot of folks who think, oh, well, you know, you can just take care of these vets anywhere in any physician's practice. A patient's a patient, a patient. Well, we know that that's not true, and these veterans have really specific needs, and unless you really buck up on military service-related problems, like, you know, combat-related PTSD or military sexual trauma or burn pit-related respiratory problems and cancer, or Agent Orange-related illnesses, there's just a baffling array of these problems. The VA takes care of these problems because like that's all they have to take care of, right? So I think that these groups can be engaged with, veterans can be engaged with. The trick, of course, is how do you reach veterans with your message? I think groups should engage with, many people have already engaged with groups like Veterans for Peace. Common Defense is a wonderful group that Veterans Healthcare Policy Institute that I helped found and works with on a consistent basis. There are lists, that you can purchase to reach veterans. You can, for very inexpensively, you can do Facebook groups, regionally and even locally organized. I'm not very good at this, but you can reach out to veterans and their families and warn them about the threats to the VA and say, here's an alternative. We have an alternative for the problems of the attack on the VA, and that is a universal healthcare system, and also which would release funding, even more funding for veterans healthcare, and could expand the VA to include their families and so forth. Rick would be, I think, quite interesting, and I hope he will join in to talk about how veterans' mental health problems don't just impact veterans. They impact veterans' families, their kids. PTSD is kind of the gift that keeps on giving. How many vets have you talked to who have PTSD, young vets, and then you ask them about their families, and their father was in Vietnam, and their grandfather was in Korea or World War II, et cetera. So I think that veterans are very easy to engage with. I think that sometimes I've been very disturbed when I talk to folks on the left who think that, well, the VA is sort of part of the problem because it upholds, the military industrial complex. I think that's false view. I think some people on the left think, how can I talk to these vets? They're not engageable, and I think that's incorrect. I think that one has to carefully construct a message. I think one has to be respectful of their issues, and I think the message needs to be crafted, and I'd be happy, to talk to folks about that. But I think that this is a wonderful discussion to launch and to talk about how you can reach veterans and what arguments you should use and bringing them in. The other reason to save the VA and expand the VA is that, the more people you have who've experienced the benefits of a socialized medicine system, the more of a base you have to expand that system to all Americans. And I think the trick is to help veterans understand that by expanding this model, not the VA so much, but the VA as a model of care to all Americans, you are not threatening their system. Because one of the things that the right wing will swoop in and do, and this is really ironic because the right wing wants to kill the VHA, but when, people like us say we want to have Medicare for all, or we want to use VA prescription drug negotiations in public hospitals in California, the right wing swoops in and says, oh no, you can't let this happen because this will jeopardize your benefits and your system, and we have to help them understand that that isn't true, and you really have to be prepared for that. So I think I'd like to conclude. Please forgive me if I took longer than you allocated. I'd be happy to answer questions. And so I guess if you want to open it up for questions, is that what you'd like to do now?
Yeah, that'd be great, Suzanne. And that was wonderful. And you do such a good job in your presentation. I think you anticipate so many of the questions that are in our mind. And maybe in the Q&A, we can just drill down a little deeper to come up with some mechanisms and some, again, best practices. Grateful for your offer of continuing support. And I agree with you 100%. It's a messaging challenge for us. And if I didn't mention it to folks, I'm here in Washington, D.C., and I moved here on September 1st. So I want to work this is our inside outside strategy so that I can go directly to members of Congress and get to their legislative aides, their legislative directors, and so forth. And believe me, that makes a heck of a difference. Just keep showing up at their door. Won't ignore you. I mean, this is a 2-3 year project to get Sabuca passed. This is the Khanna legislation. And Suzanne, just so that you're clear and other people are clear, and then I'll open it up for questions. The bills that we're supporting at the state level are designed not to meddle with the VA, but actually to wrap around and provide what is not present or available to veterans. Many of them it's a difficult challenge to get to VA hospitals. And for many people, it's a huge benefit to get that care locally, right? And to build a relationship with the local practice. But there are certain things the VA can do that the private system can't, which is your point of emphasis here as well. So I think it's all about, yeah, please. Is that fair?
I think I would love to have a chat with you about that message, because I think that you have to be very careful about that message, because that's the message. And so I think that when you, I worry about that. And I mean, we can have that conversation offline, but I think that, this is precisely what the people who want to kill the VA are saying, is that you can get services in the private sector. You shouldn't have to drive. You shouldn't have to do this. You shouldn't have to do that. And I think that what you're doing, if the veteran is in the VA, if you're taking patients out of the VA and you're also subjecting them the way it exists right now to uncoordinated care and to people who don't know about their problems. So I would love to chat with folks. I mean, it's a much longer conversation, this conversation about how you tell veterans about private sector care. I mean, I personally think that, we should be arguing for VA for all, not Medicare for all, because we need a delivery system that gives the kind of comprehensive coordinated care to people that the VA does, or like the NHS does when it's properly funded. I just worry about the nuance here, because, the reality is the way our healthcare system is constructed right now, the folks who can't get to a VA also can't get stuff for anything, right? I mean, like rural people, hell, because, and I'm sure you've all talked about the rural healthcare crisis. And I'm going to put in the chat a paper that we did about that. I just worry about nuance here and the message that you're giving them. And that's all. It's just a caveat. And I'd love, again, I'm repeating myself, but I'd love to talk about this later.
Yeah, absolutely. And I welcome that. And I also know Rick Stageborg wants to have that conversation as well. So it's really welcome.
So Jeffrey has his hand up.
Jeffrey and then Lloyd.
Yeah, I'm going to say, as being a product of the Air Force, and Sacramento was and continues to be a retirement community, is how, as being a retirement for the VA, what resources are here and what resources are far away. But there's more background to it, and I do appreciate and do realize that we need to show the example of what the VA offers, because most people do not understand, as Susan pointed out, what the VA does offer. You just hear people say, VA provides my services. Doesn't explain to the common people that's trying to go after what you're proposing of universal health care. It does not explain that. We need to help people understand what the VA does provide. This is for the disability community, was so helpful because they got it, and the veterans made it very helpful because of the disability issue of helping the federal government understand what to do. And I'll stop with that.
Suzanne, do you want to respond or just let that?
Oh, no.
Okay, let's go over to Lloyd Alterman from New Jersey.
Hi, thank you
Thanks,
so much
Jeffrey.
for your talk. I really appreciate everything you said. I wanted to let you know, I'm a retired physician, and when I had been in practice, I would say I had half a dozen patients who saw me for their care, also went to the VA so they can get their medications free. And to me, this seemed a bit of a duplication of service, and yet I would be reluctant to tell them, don't come back to see me, because obviously that's off-putting and not good customer service or social interaction. And yet, I marveled at how we were duplicating service. Just wondered if you had any thoughts about that issue, because I'm sure many veterans do exactly what I'm describing to you.
Yeah, I think I think you raise a really important point. It's not only that it duplicates, but it subjects people to fragmentation. And I think that those physicians on the call, or nurse practitioners or nurses or those in healthcare, I mean, what we have now with the Mission Act is you have almost 60% of veterans going into the private sector, into a fee-for-service system that doesn't coordinate, but in fact does the opposite, fragments care. They don't know how to collaborate. There's no CPT codes for collaboration. And so vets are, getting very fragmented care that they never had in the VA because care is coordinated. And the care coordination is not just that they share the same medical record, but people actually talk to each other about their patients. And so, I mean, it's an interesting dilemma for a doctor, because I sort of think that I always tell my veteran friends who have Kaiser and VA, and they think, oh, 4 minds, or now I have 4 people working on my problem. And it's like, you want to say, no, actually, that's not a good idea. I mean, unless the people at the VA have failed, you don't want more cooks telling you 12 different things about your problem and then nobody coordinating. And we have seen massive problems with care fragmentation, which is, as you know, endemic in American medicine, and kind of the point, because if you have care fragmentation and you have bad outcomes, that's more money for all kinds of groups, right? That's a dirty little secret of medical mistakes, is that unless a person just dies on the table in the OR, it's lots of money for the hospital and the drug companies and the people who make the tubing and the saline drips and blah, blah, blah. So I think that we need a system for all of us. If we had a universal healthcare system, the VA, everybody would have the same medical record, they'd share the same medical record, and you would have people would, not, I mean, I don't think you should force veterans necessarily to go into the VA, but you could have the VA explaining and having, the staff to explain why it's important to have coordinated and integrated care, and go to one place. I mean, on the subject of meds, I remember going in with a VA home care nurse practitioner to this vet's house. He had a lot of mental health problems, and we went into his house and looked at the disaster of his medication collection, which he got from Kaiser and the VA, and he changed the bottles. I mean, she could not do med rec. She couldn't do medication reconciliation. She couldn't figure out anything. And a lot of veterans have cognitive problems and mental health problems, traumatic brain injuries. So, this is a real nightmare, having care fragmented for them. It's a nightmare for all of us, for those of us who aren't veterans. So thank you, Lloyd.
Let's bring up Victor Madeja and then maybe Rick for some feedback, comments, discussion. You're more in the know. Victor, are you available? And then maybe Rick.
Yes. Can you hear me okay?
We got you.
Hi, my name is Victor Madea. I want to thank you, Chuck, for setting this up. And Suzanne, I agree with over 90% of what you said. The other minor points I'll talk over with Chuck. So I'm a West Point graduate. I volunteered for the infantry. I volunteered for Vietnam like many others. Um, I served in 1971 in the 101st Airborne Division as a rifle platoon leader, and in 1972 in the 196th Light Brigade near Da Nang as a rifle platoon leader. The proudest accomplishment in my life is that all my soldiers survived that criminal endeavor. And I would like to stress that leaders lied, and that's why liberty died. And until we remove those criminals, I don't see any possibility for change. So I think we shouldn't put the cart in front of the horse. Now, my West Point class sponsors something called the National Council for Ethics in America. And I would seriously question how much ethics there are in America. But that's a longer talk. If, I was a member of Veterans for Peace, but frankly, I think it would be better if they integrated with those so-called conservative groups and voice their opinion, because those groups are open to change, because each one it's all different depending on what part of the country you're in. Now, for the last 10 years, I've been doing 2 emails a month, thousands of people. But my last one had a presentation on the definition of government. It was a crash course in government, 43 episodes. This has been around for a while. The bottom line is, at the end of the Civil War and the 14th Amendment, the Bill of Rights was applied to the states. The states do not really enforce the Bill of Rights in many cases. I have taken 2 cases to the US Supreme Court. Certiorari denied. And it was a very simple issue. It was the issue of due process and being denied a jury trial. I'm just offering that as an example. Another example is, this is the policy book for Pennsylvania, listing the laws that apply to veterans. It's 350 pages. It's almost indecipherable. And the issue is partly that you're competing for money, for federal money, and appointing people, and it becomes a power struggle in some sense. And yet the county officers are often just as good as anyone else in terms of handling claims. So I also want to show this poster. This is the poster of Agent Orange for Vietnam. And it's an example of how the government has misinformed us. In other words, it wasn't just Agent Orange. There were 6 different kinds of chemicals that were used in Vietnam. And there are many veterans still suffering from these. And the VVA has been very good about talking about that. So when people walk up to me and thank me for my service, many of them are pirate patriots, and I don't get into a discussion with them, but I hand them a wristband. On one side of the wristband, it says, restore the Republic or restore the Constitution. The other side says, with liberty and justice for all. And that's a way to, if you want to start a conversation, I think, have them focus on the last 6 words of the Pledge of Allegiance, not just the first 6 words. See if they agree that there might be an issue with liberty and justice for all. That's where the universal health care issue, I think, can be helpful. I'm focused on veteran care and trying to get the word out. And outreach is a major challenge, as you well know, I believe. And I think that's something we can talk about, Chuck and I, and maybe have a monthly, at least, I would say at least a monthly Zoom presentation, maybe on the 4 freedoms and how they're being interfered with and how we can restore them, and then or on healthcare. But I think healthcare itself won't attract a lot of people. You can walk into that. But the four freedoms of World War II, 16 million people. The biggest medal we ever awarded was probably after World War II, showing the four freedoms. So that's a theme that I think can be used to join people together. I'm the national vice president of Thomas Paine Friends. If you go to my website, which I've listed in the chat, www.valor, VALOR, www2.com. The whole first page is about Thomas Paine. So Thomas Paine, Ben Franklin, Jefferson, they have some ideas that I think can be applied in terms of liberty and justice for all, in terms of the ideas in the Constitution, in terms of eliminating the criminal element of our government, because anyone who would support the Trumpers, I mean, even the definition of insurrection. I had a long discussion yesterday with a lawyer who can't even accept the definition of insurrection. But that's about, I think, all I want to go into as far as politics goes. I think the idea of liberty and justice for all is a good unifying theme to build both veterans care and the idea of a single payer or universal health care. And I'll be here for questions. That's all I have. Thank you.
Thank you, Victor. Go ahead, Suzanne.
Yeah, the DAV is a wonderful group that I work closely with. Sadly, the DAV promoted the Mission Act, as did all the veteran service organizations, the traditional VSOs. The DAV is now sort of having a certain amount of buyer's remorse. VVA supported it too, and that was a big tragedy. I think the I think that people should join some of these groups if you can. I mean, one of the big interesting problems with some of the major veterans groups, with the exception of Vietnam Veterans of America, VVA, and Paralyzed Veterans of America, PVA, is that they demand as you can't be a member if you have what's called a bad paper discharge, which is really a terrible mistake, and they should be petitioned to change their policies. But these groups are, the problem is they're waning in influence. DAV is now the best, I believe, among them. And I think every vet who's disabled should join and try to push it even further in a good direction. But the traditional veteran service organizations have not been able to attract younger members for very good reasons. And so many of them are now being taken over by corporate healthcare interests. And that's why they've been supporting these kind of privatization movements. But I still think pressure should be brought to bear on them, and we should work with the ones that have more veterans' interests rather than corporate interests at heart. I'd be really interested in hearing from Rick. But
can I just add one point? The concerned veterans group, I completely agree with. I talked to them. They had a table in Florida with the VVA group, and I talked to one of their reps, and this is what they gave out. They gave out a rubber hand grenade, and the speaker admitted to me that he was getting benefits, and yet he was talking about giving more benefits because they cost too much. So I think that's something we should warn veterans about. The Concerned Veterans of America is not a good group.
yes, so Concerned Veterans for America is the Koch brothers funded group.
Yes.
Yes. And they have a lot of money behind them and have really been very successful. They infiltrated Fox News, and they're really terrible. I totally agree. Yeah.
Okay. Thank you, Victor. Yeah, we'll keep this conversation going. Rick, can you come up and offer some thoughts for Suzanne to interact?
Yeah, absolutely. First, I'd like to thank Victor for his service through DAV and VVA. one thing I'd like to talk about is my own experience trying to explain to people the problems with the VA. I think the one point maybe that Suzanne mentioned, but maybe didn't emphasize as much as I like to, is the integrated nature of the VA. And if we want to preserve that in a universal healthcare system, we really have to figure out a way that we can coordinate the two. Because, well, if there's going to be one system, they got to be coordinated. And we want to maintain that integration. So Suzanne mentioned that currently there's a lot of disintegration of services because of trying to work between the private sector and the VA. And that's absolutely true. I'm a veteran myself, and I receive my services exclusively through the VA. Well, they pay for everything, but some things they have to outsource because you can't really have two completely separate. I mean, the VA can't reproduce the entire healthcare system. We couldn't possibly afford that. The veterans are not distributed equally. We could certainly use more VA clinics. And that's part of the problem that I wanted to get to. Talking about it here, I'm the chapter chair of Veterans for Peace in Corvallis Mid-Valley in Oregon. That's about 70 miles from Portland. And we don't have a clinic, even though there's a pretty large number of veterans here. Some of whom have to travel all the way to Oregon City, which is nearly as far as, well, it's about the same distance as Portland. That's a long ways to go for a primary care appointment or a lab draw. So there's a lot more that could be done, but we can't afford to do it this way. This is insane. I have had to use community care myself. Well, let me just say one thing about community care. When they opened up in the Roseburg system, which is it's a pretty small group of clinics, we had a little town hall where we were informed that they hired 70 people to run the community care system. I couldn't believe the number. I had to double check with the director, and that's what he said. Yes, or they had 70 people handling it, I should say.
7 or 70?
Pardon?
7 or 70?
70 is what he said.
70.
I know, I couldn't believe it. Maybe don't quote me on that, but I swear I checked with him, and he didn't. In the way I phrased the question, he didn't disagree that that was the correct number. That's the number I used when I asked him. Maybe he just didn't hear me, because that does seem unbelievable. But the point is, there are so many people. These people, some of them, they weren't all just hired. They were taken away from the frontline service. They were taken away from delivering real care. And then when I had to use community care myself, it takes 2 weeks to get a response. Because guess who handles community care? I mean, sure, we have VA employees initiating the things, and then they go through a private insurance company, TriWest. At least I think that's still the current provider. And TriWest takes 2 weeks just to give you a list of people that you can contact. Then you have to do that on your own. It's insane. And it's not the way things were done before the community care system was set up. The VA actually made appointments for you, and they did it quickly. It's just nuts. They're spending all this money to make things less efficient, and then they want to claim that this is supposed to get you quicker care. That's not true. I waited 2, maybe 3 weeks to get a response to see a podiatrist because the VA does not have enough podiatrists. And it was, and it took me like 2 days to get in once I actually had a name to contact, and they had the authorization. So I pointed out in the chat that they could be much more efficient if the VA just did it themselves. And if there was, if it was an integrated system where, there's not all this rigmarole to go through, just go back to the way they were doing it before.
Yeah, and Rick, I think you can agree that, the VA always used some private sector care through fee-based care. They always used fee-based care if they couldn't handle something, but they used it judiciously and kind of episodically, not as a standard way of practice. And I mean, I think what's really interesting, and I'm so glad you pointed this out, Rick, is we don't even know how many VA staff have been pulled off direct care duties to work in this so-called insurance company gatekeeping section called Office of Community Care. And we also don't know how many people are, new people have been employed in these offices of community care surveying, private sector providers. But I mean, one of the things that's happened is that the VA has been tasked with coordinating the care of private sector providers who don't coordinate, with them. And so Rick, Rick knows, coordination means, takes two parties. It's a relationship. And if one party wants to coordinate and the other party doesn't, then it's like a nightmare for the coordinating partner trying to deal with the non-coordinating partner. And that's what you have. You have a non-coordinating partner. And so you're wasting a tremendous amount of time and money. I mean, if the clinical care budget of the veterans, if the Veterans Community Care Program is now eating up $60 billion, the VA medical service, the VA clinical care budget, including community care, is $128 billion in 2023. And the community care got 30 billion, but is actually eating much more of it. So let's just, just for fun, let's just say you have $50 billion going to private sector providers who give lower quality care at a higher cost. What they've done with the community care is very interesting. They didn't intend this. Congress did not intend this, but you created essentially a double-blind, gold standard, trial where you're sending folks out to the private sector and the VA, and we now have data comparing how the private sector does and how the VA does. And every single study that's come back, these are scientific studies, show that the VA delivers higher quality care at lower cost. Sometimes community care actually is killing veterans, right? And we're still sending them out to the private sector. One of the lines I think we could be using is, okay, imagine you want to go to a hotel or hire a contractor or go out to dinner, and you go to Yelp and you see that, this restaurant, this hotel, this contractor has 5 stars and all the reviews are great. Oh, the care, he was very responsive, he coordinated, the meal was wonderful. And then you have a whole bunch of 1-star reviews. And what Congress is now doing and the 1-stars reviews say, the meal was not good. I actually got food poisoning and it cost an arm and a leg. And when I got the food poisoning, the restaurant was completely unresponsive. And basically that's what we have with the community care program. And Congress is sending veterans to the 1-star contractor where the roof collapsed after he put it on the house, and stealing money from the 5-star providers, And I think we have to say this is like completely unacceptable. Not only that in every other health insurance program and national health system, if you want to go out of network, if you just don't like the VA and you want to go out of network, you have to pay for it. Like in TRICARE. TRICARE is TRICARE Select and TRICARE for Life, which is the DOD's private sector, program for people who were career military. And in TRICARE Select and TRICARE for Life, they set up these networks, these provider networks. If you want to go out of network, you have to pay a very hefty copay. And also the provider can charge 15% more than, the provider network does. This is the DOD dealing with the same population. These are our revered service members, right? the DOD does it the way other insurance companies do it. If you are part of the National Health System of Great Britain, you can't go to France just because like you feel like, oh, it'd be so nice to be taken care of in Paris. I could go see the Eiffel Tower while I see my gynecologist. And we have created a monster. We have to put it back in the box. We have the arguments for putting it back in the box because the care is no good and it's more expensive and it actually kills people.
Yep. Let me just make the other point I wanted to make related to that, though. I work with SOVA, the Save Our VA group, which is a national group associated with Veterans for Peace. And I've had a couple of problems. We actually did some actions when I lived in Roseburg, where they have a hospital, which was great. Got some newspaper coverage. And then I moved to Corvallis and found a group of people who are so tired of being thanked for their service, blah, 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 that they really don't even want to identify as veterans except as spokespeople against war. So they don't think we should be putting in our efforts at helping veterans. But veterans are victims of war too. I mean, our members don't have severe PTSD, to my knowledge. None of them do. And as a former VA psychiatrist, I have a lot of sympathy for our combat veterans. Not just the ones with PTSD, they're all affected. In fact, all civilians are affected too, not just their families. I mean, we're all paying more. War is destroying our societies, which is one reason we're the only country who can afford universal health care, which is most countries really, that doesn't give it to them. We don't have that as a value. So what kind of country do we fight for? Anyway, because of that attitude, we haven't really got much going to try to publicize the problem. And it's hard to do here because we don't have our own clinic and people have to travel so far. There's actually a closer clinic that most people aren't able to utilize. It's only 50 miles away. Well, yeah, it's close to, no, I'm sorry, 30 miles away. I apologize. But that's still a long way to go for a lab draw. But I put up with it because I want to keep the money in the system. And I hope that doesn't cost them more than paying private, but I don't think it does. I think they actually would pay more for private, even though they pay mileage for disabled vets like myself.
Well, I mean, the reality is that if you have a healthcare system like the VA, where you're paying the providers, you're paying the labor costs, and you're paying the fixed costs, and then people aren't using it, you can't afford that, for that long. And, I mean, the reality is 30 miles. I mean, I don't understand why, I think we have to tell veterans if they want a system that's dedicated to their needs, that has spent decades, helping them deal with their problems and understands their problems, then they have to use it. And if they don't use it, they're going to lose it. And if they have to drive 30 miles, I mean, I don't know how long that takes, but I have to, I mean, if I want to go, if I want to go to Oakland, it takes me, and it's probably 15 miles. It takes me an hour to get there, right? And sometimes, I mean, a blood draw, okay, I don't know about that, but the point is you cannot afford to have two systems for veterans. And if we had a universal healthcare system, we could iron these things out, right?
Right. I mean, Suzanne, if I may respond, though, because you're not really addressing what I said. People could not get into the clinic.
Oh, really? Because
30, yeah. That's why they're not a receptive audience.
I'm sorry.
Yeah, I mean, I was lucky enough to get in because I had a near fatal brush with pneumonia that left me temporarily pretty incapacitated. So they made it an exception and got me in, but nobody else was getting in at that time because they were understaffed. Why are they understaffed? Because money's being sucked out of the system.
Right.
So it's a circular thing.
I
And
completely
that,
agree.
but it's hard to make this case to people who, frankly, like I said, it's an individualistic society and they're more interested in themselves. They don't think in terms of a system. I earned this. And if I
Right.
can go see the guy down the street, that's what I'm going to do. But there's other people that would be willing to go, and I would make that case if they could get in. But even they have to, if they're not 100% service connected, they don't get paid for mileage, and gas is expensive for these people. Remember that most of them are there because,
Right.
well, a lot of them are service connected, but a good portion are there because of their income. And a lot of people have both low income and are service connected because they can't work because of their disabilities. They can't, or at least they can't make a lot of money. I would see patients all the time with PTSD who were so underemployed because they couldn't work to their potential because they were so screwed up they couldn't go to school and they couldn't handle certain kinds of jobs that involved interaction with the public. I mean, I could go on and on.
And we do have to honor Suzanne's schedule too. She's 15 minutes past where she said she could stay. So
30, but let me just respond. I mean, Rick just gave us a couple of really good talking points. And one is we have to recapture this money so that we can have adequate staff in the, I mean, he's given us several, 3 or 4 talking points. We have to recapture this money that's being wasted and thrown out in private sector, low quality, high cost private sector care. We have to recapture it to hire more staff. We could build more facilities or collaborate in genuine partnerships with the private sector where they're not ripping off the VA. Also, some of this money that we recaptured could be given to help people with gas and mileage and all these other things. I think that's a very interesting suggestion, Rick. And I think the point, that you just have to make to people, and some of them will get it and some won't, is that, if we had all these billions of dollars, that's a lot of money, to play around with to solve these problems. You could bring in more veterans, who have, you could raise the income level. You could bring in people who have no service-connected disability. I mean, some economist could figure out, how to, look at this bucket, look at this bucket. I think the point is that, in all our arguments, we have to focus on, look what we could do if we had this, and then dazzle people. It's sort of like you're selling a car. You go to a car lot and you don't, you look at all the dazzling new things on this car that you want to buy. And if you had the money, you could buy this car, as opposed to, focusing on how crappy the old car is. And I think if we could start with that message and tell people they could, have what they already have, which is way better than the private sector, and even more people could have it. Wow, then we could maybe motivate them. Motivating people is very difficult. I mean, you were a psychiatrist, Rick, right? I mean, and
that was part of my job, though.
I mean, you're way above my pay grade in that. And I mean, we just have to if we change one person's mind, I mean, I don't know, you have to feel. I work with a group. I work with a group of, I'm studying teamwork in a practice that takes care of women with HIV and trauma. And, they're addicted to drugs and have terrible relationships. And every team meeting ends with a success. And the success is often like, they came to their appointment. They didn't smoke crack for an hour. I mean, if we define success in terms of getting like what we want. So I think sometimes we have to define success as, gee, I had a conversation somewhere with somebody and they didn't punch me out, I mean, anyway, sorry. Thank you for your insights, Rick.
And thank you, Suzanne. Where is there legislation currently percolating or in Congress?
There's legislation percolating that's terrible, that should be fought, introduced by John Tester. And if you go to the VHPI website, I really would suggest, if people would send me, again, it's sg@suzannegordon.com. If people would send me their email, if they're interested in following this, I can sign you up for our newsletter. But there's legislation in Congress that is introduced by John Tester. And then there's terrible legislation by Moran that would outsource even more care, and that should definitely be fought. And again, if you go to Veterans Healthcare Policy Interests, veteranspolicy.org, you can find out more about that.
Okay. Well, there are potentially a couple of folks we could work with. Seth Moulton from Massachusetts. And one of our
Moulton has been terrible on VA issues.
is he? Okay, okay. And then Chris DeLuzio, just elected to Congress, a veteran. Go ahead.
Jim McGovern is much
Jim.
better in Massachusetts.
Okay.
Jim has been great. There's folks, I mean, the people who are good, Chris DeLuzio in Pennsylvania, obviously Bernie Sanders' office. Tim Kaine is showing some interest in this. He's in Virginia.
Right.
Obviously supporting DeLego over cinema. But a lot of these people just need to be educated. You know, these staffers of these legislators don't know very much. And what they know is they get from, you know, the New York Times. So any conversations that you can have with staffers about these issues, obviously Jayapal's office is very good. Ro Khanna is great. It would be great if Ro Khanna would talk more about how these bills, you know, could impact the VA and kind of bring the intersectionality. Merkley's great. I don't know, you know, there's lots of people that can be brought along. We've had success even with Rounds. Mike Rounds in, oh God, where is he from? I can't remember.
Dakotas, maybe?
He's in like South Dakota or North Dakota or someplace.
Yeah,
like
I think one of the Dakotas.
and one of the Dakotas. And again, I really would suggest folks, you know, getting in touch with Common Defense.
Yeah, we are. Oscar, I talked to him last night. He regrets that he couldn't be here today, but we're in contact, and his partner's in Northern Virginia.
Yeah,
So I'm going to connect with him.
great.
Yeah. So we'll let's keep this conversation going. Absolutely. And we want to honor your time. I know there were a couple of hands up there. Do you need a dash, or can you?
I can stay for a couple more questions.
Okay, Victor, if you can make it quick, appreciate it.
Yeah.
You're muted. You're
This is-
muted.
Yeah, I'd like to provide some solutions because, for example, Veterans for Peace doesn't provide service officers. That's one of the major handicaps they have. So they can complain about the service they're getting, and yet they don't do anything about it. I've been a service officer, again, certified for 10 years, doing 2 emails a month, thousands of emails over 10 years. Here are a couple of the solutions that might work. Travel is an issue. You can have a mobile van go around once a month to do some of these things like blood work and the routine testing. So that's part of the solution for travels, so people don't have to go to a medical center. I'm in Allentown, Pennsylvania. There are 4 medical centers within 60 miles of Allentown. I visited all of them, and not a single one of the introductory packages told me about the welcome kit. You know, it's like a blue folder that you can immediately download from the website that tells you how to get into the VA system and all the benefits it offers. So this is the type of terrible outreach they're doing at the medical center level. Forget about the clinical level. So they finally sent some of these packets down to the clinic. Half of the inserts were missing. So that's an example of an issue that we addressed in the 6 pages that I sent out on how to apply for benefits. There's also something called disability benefits questionnaires. Now, they cover like 72 different conditions. If a veteran can get his primary care doctor in the VA or outside to use that form as an application, that form is required by the contractors they're hiring to do the comp and pen exams outside the VA to verify the conditions. So in terms of hypertension, 490,000 Vietnam veterans are now eligible to get hypertension as a disability evaluation. And even if it's rated at 0, they'll be in the system, which means if they die from a heart attack or from a stroke, their wife or kids may be entitled to benefits. Okay, PTSD. Jonathan Shea, graduate of University, medical doctor, University of Pennsylvania. MacArthur Genius Award. 20 years in the Boston VA medical system. Wrote a book, I think, called Odysseus in Vietnam. He said it should never have been PTSD. It was an injury. It overlaps with TBI, traumatic brain injury. It overlaps with moral injury. So there's issues here that can be explored in greater depth in terms of filing claims. So those are possible solutions. That's all I have.
Terrific. Okay, Victor, thank you so much for that. Let's continue this conversation. Let's put together, a collective of ideas. Maybe we put together a Google Doc. I'm not sure exactly how to go forward, but absolutely, let's keep the conversation going. Suzanne, any closing comments for us?
I just want to thank you so much for having me. It's been a really interesting discussion. I look forward to having a chat offline with folks and please consider me a resource for your group anytime, and anybody who wants to get in touch with me, I'll be delighted to talk to you. Thank you. Thank you for having me.
Okay. And awesome Saturday. Have a great one. Thank you so much, Suzanne. We will follow up. Thank you, everybody.